Welcome back to Module 2 of 1016 MSc, the muscular system. This is topic 2.3, functional muscle groups of the upper limb. Now is the time to open your workbook to Module 2, topic 2.3, and see if you can start to answer some of the questions that relate to the content covered during this mini lecture. The learning outcomes for topic 2.3 Part A are to be able to identify muscles that move and stabilize the shoulder and describe their actions, and to identify muscles that move the upper limb at the shoulder and describe their actions. Before we look at specific muscles of the upper limb, let's review the general rule that we discussed in our last mini lecture. A muscle that crosses on the anterior side of a joint produces flexion. A muscle that crosses on the posterior side of the joint produces extension. A muscle that crosses on the lateral side of a joint produces abduction. And a muscle that crosses on the medial side of a joint produces adduction. We will start with the muscles that move and stabilize the shoulder. This includes muscle compartments from both the anterior and the posterior thoracic wall. In the anterior compartment, there are three specific muscles that move and stabilize the shoulder and insert into the pectoral girdle: subclavius, pectoralis minor, and serratus anterior. Subclavius is a cylindrical muscle located underneath the clavicle, running from the first rib to the clavicle. Subclavius helps to stabilize the pectoral girdle. Pectoralis minor runs from the ribs to the coracoid process of the scapula and lies deep to the large pectoralis major muscle. Contraction of pectoralis minor abducts the scapula. Serratus anterior is the prime mover of scapular protraction and holds the scapula against the chest wall. Serratus anterior is named because its origins have a serrated or sawtooth shape. Muscle fibers run from the ribs to the vertebral border of the scapula. This is the boxer's muscle. In the posterior compartment, the following superficial muscles move and stabilize the shoulder: trapezius, rhomboids major and minor, and levator scapulae. Trapezius is a triangular-shaped muscle extending from the skull and vertebral column to the acromion process and along the spine of the scapula. Middle fibers of the trapezius adduct and stabilize the scapula, while superior fibers elevate the scapula and cause shrugging of the shoulders. Inferior fibers depress the scapula and shoulder. Rhomboid major and minor are two rectangular-shaped muscles that lie deep to trapezius. They arise from the spinous process of the thoracic vertebrae and insert on the medial border of the scapula. Thus, the rhomboids act in synergy with middle trapezius fibers to adduct the scapula. The levator scapulae, as its name suggests, elevates or rises the scapula. It originates on the transverse processes of C1 to C4 and inserts on the medial border of the scapula, thus elevating the scapula in synergy with the superior fibers of trapezius. This table may provide a useful reference and summary for studying scapular movement and stabilization. The columns summarize the names of the muscles acting on the scapula, their direction of pull, their actions, and examples of functional activities that include those actions. For example, when we consider the movements of the scapula without moving the arm, scapular elevation occurs when we shrug our shoulders and the scapula moves in a superior direction due to the activity of the superior trapezius fibers, the levator scapulae, and the rhomboid muscles. Scapular depression occurs as we pull down on a rope while trying to climb. The scapula moves inferiorly due to contraction of the inferior fibers of the trapezius muscle. Abduction and protraction of the scapula occurs when we punch or box. The scapula moves anterolaterally when the serratus anterior and the pectoralis minor contract. Adduction and retraction of the scapula occurs when we pull the arm back while rowing. The scapula moves in a posteromedial direction when the middle fibers of trapezius and the rhomboid muscles contract. Upward rotation of the scapula occurs so that the glenoid cavity faces upwards when serratus anterior and trapezius muscles contract. Downward rotation of the scapula occurs when the glenoid cavity faces down, as a result of contraction of pectoralis minor, levator scapulae, and the rhomboid muscles. Use this table to test your knowledge of the muscles involved in moving and stabilizing the scapula. The ball and socket shoulder joint is the most flexible joint in the body, but unfortunately, this also means it is at risk of being unstable. Several muscles cross the shoulder joint to insert on the humerus, many originating from the pectoral girdle. 4 of these muscles are a special group known as the rotator cuff muscles. They play a significant role in reinforcing the shoulder joint and holding the head of the humerus in the glenoid fossa in order to prevent dislocation. These muscles include subscapularis, supraspinatus, infraspinatus, and tres minor. In addition to their primary role of reinforcing the shoulder joint, each of the rotator cuff muscles act as synergists in angular and rotational movements of the arm. Subscapularis, located on the anterior surface of the scapula, medially rotates the humerus. Infraspinatus and tres minor, located on the posterior surface of the scapula, laterally rotate the humerus. And supraspinatus abducts the humerus. The next group of muscles that we are interested in, moving the arm at the shoulder, are located in the anterior shoulder compartment. These muscles flex the shoulder joint. The prime mover of shoulder flexion is pectoralis major. This is a large fan-shaped muscle that extends from the sternum across the superior anterior chest and inserts into the greater tubercle of the humerus. Although pectoralis major is the prime mover for shoulder flexion, it also adducts and medially rotates the humerus. Coracobrachialis is a small cylindrical muscle extending from the coracoid process of the scapula to the medial surface of the humerus. It is a synergist of pectoralis major, as it also flexes and adducts the shoulder joint. The group of muscles in the opposite compartment moving the arm at the shoulder are located in the posterior shoulder compartment. These muscles that cross the posterior side of the shoulder joint extend the arm. Latissimus dorsi is a broad, triangular muscle of the posterior thoracolumbar region, lying deep to trapezius. It has extensive origins via the lumbodorsal fascia, stretching from the iliac crest, lower foreribs, and thoracic and lumbar vertebrae, to insert into the intertrabecular sulcus of the humerus. While latissimus dorsi is the prime mover for extension at the shoulder, It also adducts and medially rotates the humerus. It plays a vital role in providing downward force, the motion involved in hammering, swimming, and rowing. Latissimus dorsi is the antagonist to pectoralis major. Tres major is a synergist of latissimus dorsi, as it also extends, adducts, and medially rotates the humerus. It is a thick, rounded muscle lying inferior to tres minor. Tres major arises from the posterior surface of the scapula and fuses with the tendon of latissimus dorsi. As we continue on with muscles that move the arm at the shoulder joint, we next look at the abductors. Where would shoulder abductors be located? To abduct the arm away from the midline, muscles crossing the shoulder joint would be located in the lateral compartment. Looking at these images, can you see which two muscles might be involved in abduction of the arm? Supraspinatus, one of the rotator cuff muscles, initiates the first 10 degrees of abduction. It is located in the supraspinous fossa of the scapula and inserts into the greater tubercle of the humerus. However, supraspinatus does not provide the powerful force behind the movement of abduction. After this initial 10 degrees of movement, the deltoid muscle becomes the prime mover for shoulder abduction. Deltoid is a multi-pennate muscle that forms the mass of the shoulder. It originates on the clavicle and the scapula and inserts into the deltoid tuberosity of the humerus. The deltoid is made up of anterior, lateral, and posterior fibers. Lateral deltoid is the prime mover of shoulder abduction and creates the force of movement. Several changes occur during humeral abduction. Supraspinatus initiates abduction, then the deltoid abducts the humerus to 90 degrees. The deltoid then continues to lift the humerus to 180 degrees of abduction. However, during this last 90 degrees of movement, the scapula rotates upwards in order to achieve full range of motion of the arm. Deltoid is the antagonist to pectoralis major and latissimus dorsi, and also tres major. Which movement do each of these muscles produce that may be antagonistic to shoulder abduction? Adduction. Where are these adductors located? They would be located on the medial side of a joint in order to produce adduction. Here we can see the three adductor muscles of the shoulder: pectoralis major, latissimus dorsi, and tres major. This table summarizes humeral movement at the shoulder. Shoulder flexion occurs when we lift an object and the humerus moves in an anterior direction. Contraction of pectoralis major, the anterior fibers of deltoid, coracobrachialis, and biceps brachii result in shoulder flexion. Shoulder extension, such as occurs during the backswing of a bowling action, moves the humerus posteriorly at the shoulder. Contraction of latissimus dorsi, the posterior fibers of deltoid, tres major, and tres minor, produce shoulder extension. Shoulder abduction, as is seen in a crucifix position, moves the humerus laterally or away from the body. Contraction of supraspinatus, or the lateral fibers of the deltoid, produce shoulder abduction. Shoulder adduction occurs when we pull our arms down towards the body or in a medial direction. Pectoralis major, latissimus dorsi, tres major, tres minor, and infraspinatus all adduct the shoulder joint. Lateral or external rotation of the shoulder joint occurs when we lose an arm wrestle. The palm ends up facing forwards, like it does in the anatomical position. Contraction of infraspinatus, teres minor, and the posterior fibers of deltoid laterally rotate the humerus at the shoulder joint. And finally, medial or internal rotation of the shoulder joint occurs when we win the arm wrestle. In this case, the palm ends up facing posteriorly. Contraction of subscapularis, pectoralis major, latissimus dorsi, and the anterior fibers of deltoid all result in medial rotation of the shoulder joint. Can you see which of these muscles is capable of flexing, extending, and abducting the arm? It's the deltoid. Try and answer these review questions now that you have completed Module 2, Topic 2.3, Part A, Muscles of the Upper Limb. Write your answers in your workbooks, and we will discuss these during your tutorial session. This is the end of this mini lecture. Please continue with Part B of Topic 2.3.